In this episode of the Well Aware podcast, we're joined by Holly Hiles, who's a leadership and emergence coach, keynote speaker, and a person in long-term recovery. Today, we're having an open and honest conversation about alcoholism in recognition of Alcohol Awareness Month. Together, we will explore how alcohol use disorder develops and progresses, the ways it can be misunderstood or minimized, and what it truly means to live in recovery one day at a time. Let's get started.
Well, hello, everyone, and welcome back to the Well Aware podcast. I'm Dr. Lauren. I have the pleasure of being our Chief Medical Officer here at Aware Recovery Care as a board-certified addiction psychiatrist. Today, I'm so excited to be joined by Holly Hiles, who brings her expertise as an emergence coach, a leadership consultant, and a really experienced recovery advocate. She brings her experience to conversations about alcoholism, recovery, and long-term healing. Welcome, Holly. We're so happy to have you and to see you.
You, Dr. Grau. So happy to be here. I appreciate it. Thank you.
I'm going to start by saying what my favorite podcaster says, which is, where does this podcast find you today?
Okay. North Palm Beach in my home office.
Oh, nice.
Yes.
Wonderful. So Holly, you really bring, a unique perspective to this work in the recovery space because you're able to combine lived experience and really translate that, I think, to the professional sphere across healthcare, leadership, recovery spaces, even in payer conversations. You've worked with individuals, families, organizations, really helping people understand alcohol use disorder as a chronic disease and navigating the complexities that come with that. As we get started talking, tell others about your journey and kind of what led you to this work.
Okay. Well, I have the disease of alcoholism. I don't know why. I have some relatives who do or don't, and there's no rhyme or reason, and it doesn't matter. I just know that I have it. For me, it progressed over my 20s and my 30s and then barely into my 40s before it all kind of came tumbling down. And I know that it progresses at different rates and stages and uh, consequences and such for different people. But for me, it was by the age of 43. Eventually, just the gig was up. I was really a closet drinker for a long time, and then it really just, as it progressed, began to infringe upon everything outward, starting with tardiness at work and then absence from work, and it even got worse from there. So I lost a really good job with health insurance, benefits and everything at the age of 40, 42, but 42 approaching 43. And then that's when really just not only were things tumbling down, but actually coming together at the same time. I have a strong faith in things happening for a reason, even though they don't seem like it at the time. So I did ultimately get into treatment, which was never going to be a part of my story. I ended up in treatment twice. I came out of treatment. My sober date is June 5th, 2020. I came out of treatment in my final second time in treatment in late July of 2020. And initially trying to find employment, thinking and sort of deep down hoping to get back into my line of work. I've always been a healthcare marketer of some service line. So marketing to physicians and payers. And it just, unfortunately, I maybe burned some bridges or had people had a bad taste in their mouth. It wasn't pretty towards the end. And I wasn't being honest because I wanted to do everything to protect not only my alcoholism, but my reputation, because there was so much shame. But the sad conundrum to that is that it was all obvious. But nonetheless, I had really an epiphany at 3 or 4 months sober that, number one, I don't have to reinvent the wheel with my career. I can continue with the same prospects and network and such, and really just be open and forthcoming with my story, which in hindsight was pretty courageous being so newly sober, because it really is a one day at a time thing. But I felt called at that time, and at one step at a time, things led to the next. So I had a very humbling job at first, which was exactly how it needed to be. Literally $10 an hour, screen printing mugs. And then I actually found Aware Recovery Care online. And so I had the beautiful privilege of working for Aware for 3.5 years, where I really got to use my own personal experience, strength, and hope to represent the beautiful work that Aware does. And during that time, I really just solidified that this is my purpose, this is my calling. The reactions that I received from medical providers and insurance payers and organizational leaders uh, astounded me at just the disconnect of how much lack of education and misinformation and just misunderstanding there is around the disease of alcoholism. So in May of 2023, I think, if I'm doing the math right. But anyway, I took a sabbatical from Aware Recovery Care. And at that time, I opened up an LLC. We'll talk about that later if time permits. But basically, I'm a consultant, a public speaker, a coach, doing anything I can to help advocate and educate anyone who's willing to listen around the disease of addiction from lived experience, and also pursue my master's, if I didn't say that, which it all ties together. But the biggest feedback I would get would be, things like, or the most um, astonishing one, I guess, was when a doctor, and I heard this many times, said, "You mean to tell me you can't have one drink?" And I
Mm.
said, "No, not one drink." And so it doesn't matter the profession or the person that I'm talking to that doesn't have the disease of addiction. It's just, if you don't have it, you don't have it, and you will never understand what happens to us. And I think we'll get into some of that conversation as we go along too. But yes, that is how I got to where I am now.
Wow. Like most beautiful stories, stories that are covered with pebbles along the way and diversions and then getting back on the path. But yeah, you mentioned something interesting, about what the doctor said and a physician of all people saying, you can't just have one drink. Why do you think there's so many chronic conditions in medicine that we've really come a long way in our evolution of thought? I mean, I think of obesity as one, diabetes, where we really understand. When I say we Americans have a better evidence based understanding of those diseases. That being said, why do you think alcoholism remains still so misunderstood, both by medical professionals and the general public?
Wow, that's a loaded question. My opinions, really from my experience, we discuss in recovery how oftentimes we as alcoholics, and again, I touched on it before, it's twofold. We'll do anything to protect our drinking or using. Alcohol was my drug of choice. I consider addiction and substance addiction and alcoholism all the same, from my experience and that of learning from my peers. Um, we'll do anything to protect our using because we think we can still control it. So, like, how dare somebody try to monitor or manage what we do with our substance use? But at the same time, I really think it comes back to thinking we can control it. But unfortunately, we can't if we're a true alcoholic or addict. And unfortunately, we are hurting others, even though we live with a lie for a long time, or I did. I should keep it all to my personal experience that I wasn't hurting anyone else, and the consequences do build up, and they become tragic in some cases to the loved ones around us, to our employers who suffer and lose good employees who they've invested in. So I think because it's stigmatized is the short answer, which I should have started there. It's just still so stigmatized. But we as alcoholics, when we're in our addiction, we don't help that. I mean, we're the ones that are really fueling that, because of our behaviors when we're in active use. And I've found, and I personally believe that I'm a very good person. I wasn't a bad person trying to become good. I was just a sick person trying to become well.
Mhm.
And once I became well, the beauty of recovery too, a good, solid, thorough recovery path, at least that's the one that I finally have taken, has enabled me to also clean up the wreckage of my past and turn a lot of good things around. So yeah, I think that's why. And again, if somebody doesn't experience what we experience when we ingest a mind or mood altering substance in our system, they'll probably never understand. Just like there's a lot of other chronic conditions I'll never understand, you know?
Well, it's interesting to hear you talk about that kind of subtle progression and the person's attempt to control it. What point do you typically see people's alcohol shift from something that feels manageable to more serious? I guess maybe outward signs. Some
Yeah.
signs, if you were counseling or talking to a loved one who had a loved one with alcohol use disorder, or friends or family, what are some early warning signs that you would tell folks to look for that might suggest someone's struggling more than they realize or more than they let on to?
Yeah, yeah, great question. There's definitely an invisible line for starters, and most of us don't catch that invisible line, hence being invisible, until we've already stepped over it, and then it is very hard to go back, if at all. But I would say the inability to control once I take one. And so if I'm that person, or I have a loved one, um, who I see like, wow, they really just can't leave, that second glass half full, or or yeah, they don't stop till they're passed out and ready to go to bed, or you know, and there are also binge drinkers who classify themselves as alcoholics or addicts. So they may not drink every day. I was an everyday drinker for years towards the end. But it still comes down to the inability to control or stop unless they're stopped. Again, going to bed, blacking out, to somebody pouring the bottle down the drain, going to jail, going to a hospital, the consequences progress as time goes on. But yeah, just the inability to control it.
Yeah, SAMHSA, NAMI, and even the CDC have lots of really fancy definitions of addiction. But my personal favorite, because I think it's just so simple, is continued use despite negative consequences. And I think what you're describing there are those negative consequences that start creeping in and becoming more and more unmanageable and more noticeable to others, around them. And you've spoken a lot about the depth of being and the importance of being supported by a community when you're in recovery. Talk more about the role of community and why you think it's so critical to staying sober.
Well, until I got around another person that experiences what I experience when I consume a minor or mood altering drug, or booze, drug, whatever the drug of choice is, I wasn't going to listen to anybody, therapists, doctors, parents, siblings, bosses, neighbors, coworkers, nobody, because I truly, genuinely felt and believed that no one understood what I was experiencing.
Mm.
And the fact of the matter is, I didn't even understand without what I was experiencing, which blew me away, because I personally, and I find this amongst my fellows in recovery, is that a lot of us are, we're independent. We're oftentimes survivors of trauma or difficult childhoods. And what just baffles us is, why is this the one thing I can't control or get a grip on, or manage? And so, when I was first introduced, and only through treatment, like I say, I was never going to go to treatment unless somebody eventually Marchman acted me. It didn't get to that point. I would not have gotten into treatment. And it was once I got to my first detox center. They bring in, they're called H&I meetings, hospitals and institutions, usually 12-step members that will come in and just share free of charge their experience, strength, and hope. And the most compelling part is identifying, or describing rather, the disease, which for me and for them, and if anybody can relate, then that they might be an addict or an alcoholic, is that two things happen to me. It's a double-edged sword when I consume one of, for me, anything. Even though alcohol is my drug of choice, I know that if I think I can have a gummy or smoke a joint or kratom, whippets, you name it, anything, that I'm going to wake up the beast. But it's an allergy, as a doctor coined it actually in 1935, 21 years before the American Medical Association classified as a disease. It's an allergy. I break out into a craving, a physical craving. It is an itch that cannot be scratched, no matter how much I scratch it. And the other side of the double-edged sword is the mental obsession. And it's not just like, wow, another drink sounds good. It is a full-blown plot of, oh my gosh, how much do I have left? How can I get more? How do I hide it? How much money do I have to get more that I can stash? And remember where I hid it. It's a full-blown plot. And if somebody's watching this, if you know, you know. So when that was explained to me in detox for the first time at 43 years old, I heard that from somebody else who had what I had. They had similar negative consequences. And they said, this is what happens to me. And then they gave me some hope of how to, one step at a time, turn my life around. I listened. I didn't get sober that first time. I ended up twice in detox, twice in treatment,
Mhm.
but it planted seeds for the very first time. And then the back end of that is there's nothing. I mean, that's what this is all about. Me feeling so privileged to be here right now is that if this lands in the ears of anybody who's contemplating or wondering or has a loved one that they know is going down, if there's any sort of hope that I can share to help another person struggling. I mean, I found my life purpose just in sharing messages like these. So, yeah, community is everything, because if they're my people, and when I tell you, we all look so different, and that's what's so cool. And it really ignites a depth of love that I think none of us ever even knew was in us
Yeah.
on a humanity level.
You talk about kind of taking it one day at a time. And we hear that a lot from folks who are in recovery, one day at a time, easy does it. What does that actually look like for you in practice or for someone living with alcoholism?
Yeah. Well, I have a pretty solid routine. I was like, no, it's not strict. It's not stringent, because I love it. It's just a beautiful, solid, consistent routine. And it has been that way since day one, my last time in recovery, or in treatment rather. Every morning I start off with some sort of inspirational, devotional, spiritual reading. When I wake up, my alarm goes off. I look at my phone, just the preview pane. If there's no major emergencies, I don't even open the phone. If I do, I'm down the rabbit hole. So then like I say, I do some readings, and somehow I feel a connection. I know it might sound woo to anybody who's brand new or not to that point yet, but just how I don't exactly understand how my phone charges up when I plug it in the wall. It does, and then it does me good for the rest of the day. And me just starting my day off feeling like I'm not alone. I know there's because I'm a miracle, and most people sitting in my shoes are miracle many times over. I definitely shouldn't be here many times over from my alcoholism. And so, yeah, so I ground and connect to some source. Don't know what it is, doesn't matter. Some bigger source than me. And then throughout my day at this point, I'm on autopilot anyway of reaching out to other fellow alcoholics, may they be newcomers or people I'm helping, or people reaching out to me. So that just takes place automatically. I do love recovery meetings. They're just it's a dose of medicine, hearing other people share, where they're at. I say I've never been to a bad recovery meeting. And by the way, there's no monopoly on recovery of any kind, but even in particular in the rooms of recovery. So if anybody finds and there's Celebrate, AA, NA, Dharma recovery, I know I'm missing a bunch, but there's just something special about the rooms of recovery. And so those meetings, yeah, I say I've never been to a bad meeting. A newcomer is going to remind me where I hope to never be again. Somebody that's kind of like just getting on their feet just gets me so excited seeing them fired up. And then, of course, I love my peers who it's like, hey, class of 2020. And then, of course, I love the people who that say I had 10 or 15 or 30 years and I went out, but I'm back. And I'm like, because I want to make sure that I learn so that I don't ever have to go back out again. And to sum all that up, basically, if I do again today what I did yesterday, I do a gratitude list at night. Those are some other little things every night. Have not missed in years. That's almost like a bookend form of prayer for me. But if I do again today what I did yesterday, I'm going to go to bed tonight sober for sure, and happy, peaceful, and feeling full of purpose, and then fired up to wake up tomorrow and do it again. And so,
I love that. I love your analogy of like reading inspirational things in the morning as your like plug up as a cell phone, like you're charging up like your cell phone does, from a spiritual perspective, and having a routine like that really works for you. I also love that you point out, I think it's super important. I'm just going to reiterate it, that there are, as I say, there are many yellow brick road paths to the Emerald City. There's not just one yellow brick road. And like you said, be it that's the great thing I think about addiction treatment in 2026 is you have so many paths to get there. And most of them honestly are free, whether it's NA, AA, smart recovery, circle recovery, celebrate recovery. There's so many different paths to get there. CBT, supportive psychotherapy, because that's the most common question I get as a physician from patients or from family members is what's the best type of therapeutic support, non-medication interventions. And it was a huge study that NIH did about 2 decades ago where they followed people over 10 years and they had some people in AA, some people were CBT, some people were just general supportive psychotherapy. They measured progress in terms of recovery with addiction. And what they found after millions of dollars of research was just what you said. All of the outcomes were really pretty similar. The one fact that kind of remained consistent that did kind of indicate more likelihood for success in long-term recovery was the patient's rapport with the other people, with either their therapist or the other people in their group, which makes sense, right? Like if you're with a group you vibe with and you jive with and you feel like is meaningful and understands you, regardless of what that path is, like that's gonna work for you. So I love that you reiterated that.
Mm,
'Cause I think
okay.
that. Um, what do you wish that loved ones better understood about supporting somebody with addiction? What are some common misconceptions and things that you would recommend for them for what does healthy support look like?
Yeah, thank you. Uh, Common misconceptions are that they can save the person. I think that's the biggest one, to understand that they are completely powerless. Nobody was going to save me. I had to, and my fellows have to hit a bottom. And so then on that topic, it's a fine line for a loved one between enabling or abandoning. And from my experience, I experienced both from different loved ones in my life. The enabling didn't work. In fact, it was once the main person that was enabling me finally was like, in a loving way, but I can't do this anymore. I'm stepping back, and good luck, and I hope your recovery people come save you is actually what they said. And then that's what ended up happening. But on the other end, I did have some loved ones who abandoned me for a long time, and that hurt. And unfortunately, as an alcoholic, it gave me more reason to drink. Which in ways is not excusable. You know, and also I will give a disclaimer that I believe, as I say, everything happens for a reason. So for me personally, those loved ones who abandoned me,
Mhm.
and maybe I'm using a strong word, but cut me out entirely, however you want to call it. Had they not, I most likely would have done irreparable damage, because those same loved ones, even though there was an 11-year estrangement, they're back in my lives in a way that is just so beautiful and so meaningful and so precious. So, I mean, it is what it is. But yeah, I think, don't think you're going to save us. You're not. Get your own help.
Mhm.
Uh, don't enable us, because you might be bringing us to an earlier grave.
Mhm.
And maybe just lovingly step back, to protect yourself with boundaries, healthy boundaries.
Yeah, healthy boundaries, healthy boundaries. Well, this has been so fun. The time flies always when we talk. As we're kind of wrapping up here, um, if someone's listening who's struggling with addiction or a family member, what's the most important thing, the most important takeaway you want them to understand, or anything we haven't covered yet, or
Yeah.
both?
Okay. Yeah. Thank you. Thank you. Um, if it's the person struggling, I just want to say that shame almost killed me. I really was so ashamed to admit or ask for help. For me, it all came down to shame. I know now, way on the other side, that was nothing but ego. And ego is going to kill me every time I have to check my ego to this day. The biggest quality for any alcoholic or addict to have a spot of a chance at success of getting sober and staying on a good solid path is a degree of humility. Not thinking less of myself, but just trusting that maybe another person, other people, would be able to help me. And that was the turning point for me, when I finally stopped trying to, like, I got this, because I don't. And yeah, same for the loved one. I just refer back to the conversation we just had before about how they can help.
I love that. So beautiful. Well, thank you so much for joining us today and for being vulnerable with your journey and honest and transparent. I think your perspective is so meaningful and powerful, especially the authenticity that you bring to it and the calmness and the hope. It's just, I know this episode will resonate with so many of our listeners, and you're doing such important work in the world. And speaking of work, as we're wrapping up here, tell our listeners where they can learn more about you and your work, or we can follow you.
Thank you. Yes, collapse to calling. That's COLLAPSE. Collapse the number two, as in take two, a second life. Calling CALLING .com for my website, and I'm on Instagram, TikTok, and YouTube.
All the socials, all the
All
things.
socials. Yes.
I love it. Well, thank you again for joining us today. For those of you listening, I watch TV a lot, and there's a lot of news anchors that have different sign-offs. But my favorite sign-off is Jose Diaz-Villar on NBC. He always says, "Thank you for the privilege of your time." So, for those of you listening in 2026, when there are a million different things you can be doing, thank you for the privilege of your time, for lending an ear for a couple of minutes, and if you found this useful or helpful, please share with others. You can find us on all the social media platforms as well. Till next time, signing off from the Well Aware podcast.
Thank you, Dr. Grauert. Thank you.